Good morning, everyone. Yesterday, Ruth Bader Ginsburg died, 87 years old. National Post is reporting, leaving one opening on the U.S. Supreme Court. Now, do you remember who, I believe his name is Neil Gorsuch? He's still a justice in the, I believe, Ninth Circuit. I think you're a circuit judge, and then there's other judgeships, and then you get to the Supreme Court. So he's still in the lower court, but he was nominated by Barack Obama, but never confirmed by the House, right? The Congress. And so we're in a situation now where President Trump gets another pick. And if he can get it confirmed quick, he could possibly do it even before the election. 50 days, 47 days, 46 days to the election. Could he get a new Supreme Court pick? Could he get 3 in one term? That would be a lot. That's a lot, right? Supreme Court justices. And the amount of judges that Trump has appointed, that's been one of the things that he's focused on in his first term is appointing judges. And there's reasoning behind it. He's a chess player. He understands what he's doing, and he's doing it on purpose. So appointing judges is important to him. And I think that he's not one to let an opportunity go to waste, right? So here's an opportunity. It's presented himself just before an election. I don't know if he can do it, but I think he's probably going to try. Or he's going to maneuver something into... He's going to, I don't know. I don't know what he's going to do, but he's going to use it. He's going to use it. I'm sure of it. Andy No is reporting. Now, I followed Emmett. Emmett is a University of Waterloo political science professor. And he says on Twitter on the 18th of September, today is the 19th of September, burn Congress down before letting Trump try to appoint anyone to the Supreme Court of the United States of America. Okay, Emmett. There he is, Emmett McFarland, political science professor at the University of Waterloo. Burn it down? Emmett, are you an Antifa member? Is that why you blocked me? Because him and I were having a conversation about, it was either about hydroxychloroquine or masks, and I referred him to one of the many pieces of evidence that I collect, and I put them up on my website for people to use on CanadaReport.co, for people to use if they want to. But it's for me, so I can go back and easily get the links and say, no, here's a report, and here's another one, and here's another one, and here's another one, and here's why I think what I think. So it's interesting that Emmett is advocating such violence. That seems seems like something that the university should be concerned about, right? It seems like it should be something that is not acceptable from somebody in his position. Burn it down? Burn it down. That seems just so violent, Emmett. Violent. Unnecessary. Okay, 2 of the leaders of Canada's political parties, 2 of the 5 main ones, are testing positive for COVID-19. Here's Richard Southern. He says 2 of Canada's 4 federal party leaders, 4, whatever. Party leaders are currently COVID-19 positive. Conservative leader Aaron O'Toole and Bloc leader Yves Francois Blanchet. So how coincidental? What timing? Here's CanGal48, and she says, so Blanchet and O'Toole test positive for COVID at the same time, right when Parliament is supposed to resume? No effing way this is real. So yeah, there's a throne speech on Wednesday. Like, I guess the leader of the Conservatives will be there virtually. I don't know. Here's Brodie Fenlon, and Conservative leader Aaron O'Toole tests positive for COVID-19. You can read that. I'm not going to read it. Yesterday, there was this whole ordeal about how long the test lines were in Ottawa and how O'Toole went to stand in line at these testing places with his family. And then it was going to be so long that they decided to skip that and go to parliamentary, like to get it through a different service, I suppose. And very, very suspect. Here's Justin Trudeau wishing people well. Here he is saying, I hope you get well soon. Aaron O'Toole, Sophie and I are keeping you and your family in our thoughts. We're wishing you a quick recovery. I don't think he would send this to Mr. Scheer. Mr. Scheer, despite the pictures where they're very cordial and smiling and all this other stuff, this is calculated, though. This is calculated, and I don't believe it. I don't trust it. This is a dance. This is a coordinated dance, right? Here he is wishing well to Mr. Blanchet. Sorry to hear the news, Yves Francois Blanchet. I'll see you back in Parliament soon. Until then, take care of yourself. Sophie and I are wishing both you and Nancy Denziel a speedy recovery from this virus. Again, this seems coordinated, right? I don't think he would have done that with Scheer, and the timing is convenient, right? Isn't that convenient? Isn't that interesting timing? Here is Robert Benzie again, and he says, Premier Doug Ford says Shoppers Drug Mart, Rexall, and Walmart will soon be delivering COVID-19 tests. We can't run at government speed. We have to run at COVID speed. And do you remember very recently when Dr. Yaf said, if you test for COVID in populations with low COVID, you'll get false positives 50% of the time. 50% of the time is flip a coin. It's the same thing. Okay? Worthless. It is worthless as a diagnostic test. Worthless. Okay? Here she is saying 50% of the time we'll get false positives.
And in fact, if you're testing in a population that doesn't have very much COVID, you'll get false positives almost half the time. That is, the person actually doesn't have COVID, they have something else, they may have nothing. So it will just complicate the picture.
Why may they, she says they may have nothing. Why is that true? That's true because they take a little bit of you, the test, and they have to swab way back in the head, like in the back of your brain, right? That seems odd for a virus that is so contagious that you need to wear a mask regardless. And they take that and they amplify it, right? And I was going to read a report about this, but I am no expert and I don't want to start talking like Dr. John, right? So please look into how they're measuring this, how they're testing this, and what these fragments could be because they're amplifying it, right? So false positives are a thing. This is the head doctor in Ontario, Dr. Yap. And she is saying half the time the test yields a false positive in populations with low COVID. And now we're testing everybody? Brian Lilly does a good job at looking at the impact of this, and we'll get to that in just a second. I want to show you this pundit class. Put a thread together yesterday, and he says, previously only people with symptoms could get a test. Now asymptomatic people can also be tested. False positives among the asymptomatic approach 50%. Hospitalizations and deaths are low and falling even as cases increase. Is this a second wave or herd immunity? And this is data, and this is from Ontario's data set. And here's the second tweet. Daily deaths are where the rubber hit the road. The crisis is over. Don't confuse testing kerfuffle with a crisis. And this is the same chart I showed yesterday. This is up to, well, it's got September 10th on there, but the deaths are very low and have been very low for July and August, and we're halfway through September more. And these ideas of closing us down again are not a good idea. Back to this. An Ontario public health official recently said that false positives rate among asymptomatic populations is almost 50%. So not all reported COVID-19 cases are actual SARS-CoV-2 infections, and the gap will grow. The gap will increase. Here's the Sky News. It says coronavirus common colds may account for some reported COVID-19 cases, PHE survey says. And among children aged 5 to 14 back at school since earlier this month, the rate of rhinovirus infections shot up by nearly 80%. Public Health England weekly coronavirus report shows a rise of almost 23% in rhinovirus infections, which should include common cold in the last week. Children aged 5 to 14 back at schools earlier this month, the rate of infection shot up by nearly 80%. The survey acknowledges that it may account for some of the acute respiratory incidents reported. Large increases in NH111 cold flu calls and GP out-of-hours consultations for influenza-like illnesses were also recorded. Acute respiratory infections, ARI, rose by 729 over the last 7 days, including 193 cases in educational settings. Of these, 110 had at least one linked case that tested positive for coronavirus. So the situation is muddy and getting muddier, but in Canada, and I just wanted to show you that common colds may account for some reported cases and what that looks like. This also goes through the difficulties the schools in the UK are going through, retaining teachers and keeping having kids come back into classrooms because they can't get access to tests. And again, problems with 50% false positives, right? Like get a positive test and you've got a healthy kid. What do you do? Back to this. Public Health Agency, back to Canada. So that's just looking around the world, but it can inform Canada's response. It can inform what you think about things. So be aware of what's happening around the world. Okay, staying with coronavirus, this is Public Health Agency of Canada president resigns as COVID-19 cases spike. This is an interesting case. Kind of sounds like she's stepping down. Well, there's three stories. She's leaving the job. Theresa Tam says she did a bang up job, and the complaints about her agency say she didn't. So It's interesting. And she's a bureaucrat, so she's bounced around as well. And I don't know what her history in health looks like, but it's odd to note what else she's been a part of in recent history, in the recent past. Okay, here it is. The president of the Public Health Agency of Canada, PHAC, is stepping down only 18 months into the job, leaving the federal agency tasked with coordinating the country's COVID-19 response without a seasoned leader, Tina Namisnowski, sorry if I've got that wrong, said she would be stepping aside immediately to make way for a new president. A spokesperson for Health Minister Patty Haydu said the government expects to have a replacement for Namisnowski in the coming days. In a letter to staff, Namisnowski, a long-serving bureaucrat, sorry if I've got that name wrong, that's what I'm going with, she said she needs to, quote, take a break and, quote, step aside so someone else can step up to lead the agency as caseloads spike and testing times creep up in some parts of the country. Quote, you really need someone who will have the energy and the stamina to take the agency and our response to the next level, she said in internal correspondence announcing her departure. CBC News has seen a copy of her letter to staff. I scroll down. Before her appointment to the top job at the PHAC in May 2019, Namisnowski held a number of senior positions within government. She served as the executive vice president of the Canadian Border Services Agency and was an assistant deputy minister at the Agriculture Canada and Public Safety Canada. Is that well-rounded, or is that just shuffling somebody around? Right? And the fact that she's stepping down now, is that throwing her under the bus? How good of a job did she do? Well, according to Theresa Tam, here it is, the agency's chief public health official, Dr. Theresa Tam, called her work exceptional. Quote, she's a rock and truly inspirational. I felt privileged to work alongside of her, she said. I scroll down. On Namisnowski's watch, some scientists working for the Global Public Health Intelligence Network, GPHIN, complained that their early warnings about the threat of COVID-19 were ignored or inadequately addressed by the senior staff at PHAC, of which Theresa Tam is a part. The network is a federal government-run monitoring and analysis unit, alerted senior officials to health risks around the globe by compiling media reports and other intelligence about outbreaks. CBC News reported in April on concerns about the network's alerts not being as widely disseminated as they had been during past health crises. The Globe and Mail had also reported on internal concerns about the efficacy of the reporting system after changes made in 2018 and 19 shifted the network's focus away from monitoring global health trends to a more domestic role. Health Minister Patty Haydu has ordered a review of the network amid the complaints. So this person's leaving, and people have been complaining for years about the poor performance of the agency, and this person has been shuffled around different ministerships and presidentships in the Canadian bureaucracy environment. So, I mean, all of that is interesting to note. Is she brothers with, or siblings with a person named Wernick? No? Anybody related in the PMO? No? I'm just wondering, what are the connections? Bureaucrats seem to have lots of connections, right? It's who you know in Justin Trudeau's Canada. CTV News is reporting, moving on. Premier Doug Ford and Health Minister Christine Elliott will be holding a rare weekend press conference today at Queen's Park. It comes as COVID-19 cases continue to rise in the province. You can watch it live on City News at 11. Sure. Here is Paul Mitchell. He's a former PPC candidate. He says, according to Global News and Ipsos, 75% of Canadians approve of another coronavirus shutdown if a second wave hits. Ipsos. Let's verify these poll results and see if they're true. Do you approve of another coronavirus shutdown if a second wave hits? And 92% of 1,200 votes say no. Now, Twitter's not a balanced poll. It doesn't remove people who are not Canadian, so take it with a grain of salt. Usually Twitter does not reflect Ipsos polls or anything to that effect. But I don't believe Ipsos polls recently. I don't believe most polling done. And if they get a result they don't like, they take a subsection of this result of this 100%. If you just poll women, you get this result. If you just poll men, you get this result. If you just poll under 18s, you get this result. If you just poll 24-year-olds, you get this result. So then they'll use those results you want, right? Like, so I don't care about the polls, but they're interesting because it's interesting to see what they're trying to push. But the poll numbers are absolute trash. I don't believe them, from Ipsos to Angus Reid to any of them. They're just trash, because they take subsections and magically make them say whatever they want, right? Oh, liberal support's up among 24-year-old women, right? Like, Right, that's it. Here's Brian Lilly. He says, sure, there were 401 new cases reported in Ontario, but those numbers need context or we will just create an unneeded panic. I think that's what they're trying to create, Brian. That's what they're trying to create. Ford's having a rare weekend conference. Oh, no, the cases are up. We've got to do better, everybody. Oh, right? Like it's... No, sorry, I don't believe you guys. I don't believe you at all. Toronto Sun is reporting context needed to avoid panic over spikes in COVID-19 numbers. If you track the daily case numbers for COVID-19 in Ontario, then Friday's numbers were a shocker. 401 new cases, the highest we've seen since June 7th. Are we heading for a second wave? Ottawa's chief medical officer says it's here. Yes, we're seeing a rise in cases, and it's the speed of the increase that's concerned us. Dr. Vera Etches said the province's two biggest cities are seeing persistent case numbers that leave medical officials worried. Well, let me give you some shocking news and then some context. We are only going to see the daily numbers of cases increase and soon surpass the high of 640 set on April 24th. But that doesn't mean we need to panic. Medical officials are right to be concerned about the increase in cases. Case increases, if left unchecked, lead to higher levels of hospitalizations. Maybe. We haven't seen that yet, Brian. Back to this. We're seeing a spike in hospitalizations. We aren't seeing a spike in hospitalizations, and there are major differences between cases now and cases in the spring. First off, part of the reason we're seeing more cases is that we are doing more testing. Provincial labs are currently processing more than 35,000 tests per day, and it's only going to keep going up. Our fall plan will allow us to ramp up to get 50,000 tests within the next 2 weeks, and then we will move up from there, Health Minister Christine Elliott said Thursday. The eventual goal later this fall is to be processing 75,000 tests a day. Elliott said the fall plan includes expanding lab capacity to be able to handle the increase. While there are massive lines in some parts of the province, pharmacies, starting with Shoppers Drug Mart, will start administering tests next week to deal with the surge in demand. On June 7th, the last time our case count was this high, the province processed 19,374 tests, and on August 26th, the last day, we were below 100 cases. The number of tests were 21,960. The number of tests being processed now is 63% higher than that day in August and 85% higher than that day in June. That doesn't mean case counts are not rising, but even as they rise, other metrics, such as the number of people in hospital, remain stable. There were 58 people in hospital on Friday, with 20 of those patients in intensive care and 10 of those on ventilator. We've been below 100 people in the hospital since the end of July, down from a high of more than 1,000 back in May, and for those in the ICU, we peaked at 263 people in intensive care on April 13th and haven't been above 50 patients since the end of June. These are the numbers to watch to see if the second wave hits us as hard as the first. The profile of those getting COVID-19 has also changed dramatically from the spring. At the end of May, the percentage of people under 40 contracting COVID-19 was 43%, and those over 60 was 24%. Last week, the number of people under 40 testing positive was 65%, while those over 60 sat at 13%. Those over 60 are more likely to have severe outcomes from the virus. Those over 80 are more likely to die from it. Only 12 people under the age of 40 have died from COVID-19 compared to 1,929 over the age of 80 as of the end of last week. We are seeing more tests, so we will see more cases, yet until these other numbers start to rise, there is no need to panic. The path we take forward is literally in your hands. Wash them. Okay, so what I was saying before basically is that hospitalizations and ICU cases are not rising, and Brian Lilly makes the same case and says we need to put this into perspective. Even if we have 1,000 cases, if people aren't dying, if people aren't being hospitalized, and things aren't going poorly for people, then is this a big deal, or is this just another respiratory flu virus, right? Like, seems like just another respiratory flu virus. Jagmeet Singh says, on the day Ontario has hit over 400 new COVID-19 cases, Mr. Trudeau has called a by-election in Toronto, or by-elections in Toronto. And because of COVID-19 elections, Canada says they can't have on-campus voting. We can't let this stand. Justin Trudeau should not have created this problem. For months, we've been calling on the government to put in place changes to ensure elections follow safe protocols. We've been trying to make sure everyone can vote and have their voices heard. Students have a right to vote. We need to make it easier, not harder for them to vote. I think having a hissy fit about voting on campuses, can the students not go to another voting place? Can they not make it to another voting, like a polling booth? That seems like a very small ask, right? Like, because of safety, you understand the need, right? Go vote here instead of here. Yeah? No? Maybe? Okay. Here's Ryan Tumility. Sorry if I got that wrong. Tumility. Sorry, I forgot that. I've definitely got that wrong, Ryan, so I apologize. He's a parliamentary reporter with the National Post, and he says Prime Minister Justin Trudeau has announced by-elections in New York Centre and Toronto Centre for October 26th. Prime Minister doesn't share his thinking with me, but I assume cause is there are pretty safe Liberal seats, and the desire is to get them filled quickly in a minority parliament. Right now, the Liberals plus the NDP is 178. Still a hefty margin, but you can get a few people sick or away on business, and all of a sudden things get into a Joe Clark scenario. I don't know about that. I don't know about that analysis. I think that there's Bloc Québécois people who would probably support the government. They've got a... They're not worried about it. Anyway, back to this. True North is reporting the candidate handpicked by the Liberals to run in Bill Morneau's former Toronto Centre riding was a guest speaker at a 2016 We Day event. Marcy Ian was declared as the Liberal candidate for Morneau's former riding yesterday. And didn't Trudeau say that, like, the people in the riding could choose the candidates? Wasn't he committed to that? All candidates would be chosen by the public, in the riding, instead of the unilateral, like, being declared by the leader, which is what happened with Marcy. Brian Lilly says, the last Liberal MP for Toronto Centre stepped down over issues around the We Charity scandal. The next candidate has also spoken at We Day events. More to look into. Yes, absolutely. And Holly Doan, who's Blacklock's reporter, she says, rush order Thursday for millions of ballot pencils, a day after Prime Minister Justin Trudeau says he isn't seeking an election less than a year since the last one, according to Blacklock's reporter. So why are they getting these pencils? Just for the 2 by-elections? Emergency. We need some pencils. ASAP. Get them to Toronto. Here is Michaela. I'm not going to say her name. Miss Walsh. She is a reporter with Globe and Mail, and she says, here's the main ask for the Premier's $28 billion more in yearly healthcare funding with no strings attached. Yesterday I was talking about Santa Trudeau and his throne speech Christmas Day and what everybody wants, right? And, $28 billion is not a small ask. Now, in the scope of the current spending, and maybe that was the point of all of this current spending, to change the conversation fundamentally from like having deficits and surpluses to debt management, right? Like permanent debt management of debt service of those hundreds of billions of dollars, because somebody's making money on that. It's not the Bank of Canada. We're not printing our own money necessarily without interest, right? We're taking debt notes from a bank that charges interest, right? And so the debt service of the billions of dollars, right? Maybe that's just part of the conversation now. Is it okay to continue to spend all of this money? And somebody told me, I said, the United States has had no problem with spending trillions of dollars over their budgets, essentially. And they said, yeah, but they're the currency of the world, like the benchmark currency of the world, right? And Canada's not, is essentially the argument. And we don't have that kind of room to just kind of do that. We actually do have to service our debt. We actually do have to deal with this. So, man, I'm not sure that just asking for money is the right move for the premiers. How about some fiscal responsibility? Let's ask for some fiscal responsibility. This is the last story for today. Where are we at? 22 minutes. Okay. All right. That's not too bad, I guess. China appreciates Canadian Minister of Health Patty Haydu's objective and fair comments on China's efforts to combat COVID-19, a foreign ministry spokesperson said Friday. Patty Haydu's remarks were appreciated by the Chinese foreign ministry spokesperson Wang Wenbin in a statement. And Wang Wenbin's statement on Patty Haydu's remarks, it's just they're happy. Canadian Health Minister Patty Haydu said in a recent interview that very early on, China alerted the World Health Organization to the emergence of a novel coronavirus and also shared the sequencing of the gene, which allowed countries to be able to rapidly process tests to be able to detect detect it in their own countries. She also said the world needs to work together right now, and we need to ensure that we're working in full partnership to defeat COVID-19. The response is Wang Wenbin says, we noticed relevant reports and applaud the Canadian Health Minister's objective and fair remarks. Since COVID-19 broke out, China has been working in an open, transparent, and responsible manner to fulfill the IHR obligations and participate in international and anti-epidemic cooperation. Anti-epidemic? That's a thing now? Just add anti before it and it becomes like the woke version? At the earliest possible time, China reported to WHO on the epidemic, identified and published the genome sequence of the virus, made public our diagnosis, treatment, and containment measures, and shared the epidemic information and containment experience with relevant countries and regions. The Chinese government's put people and life first, engages in cooperation, and the results we achieved can withstand the test of time and history. I don't think that's true. The virus was said to be circulating in late September, October of 2019, and they didn't tell anybody until January. So I don't know. From what I know, this is kind of revisionist history. But hey, I'm not the health minister, I guess. I'm just watching and remembering what happened back then, right? So anyway, it's very interesting to watch this dance because the diplomacy with China is tough, with the two Michaels being detained, the threat of other Canadian business people or travelers being detained, the Wang Mengzhou being detained in Vancouver due to extradition order by the United States. So all of that comes into play with these remarks. And well, I mean, it's interesting. I don't know that it's helping anything. Like, I don't know that playing China's game with regards to rewriting history on how the Wuhan Chinese coronavirus happened will help. But I mean, Miss Haydu wants to play the game, and she's clearly signaling that. So, and China's saying, "Oh, okay, yeah, we see that and we appreciate it." Is that going to change anything? I don't think it will. I don't think it will. Little Potato's still in charge, and then after that, it'll be Tiny Potato, Miss Freeland, and then Red Dress Potato. I don't know. And then who knows, right? So, the relationship with China is very fraught at this point in time. So it's interesting, but I don't know if it helps. All right, that's enough out of me. Thanks for watching, everybody. Check out CanadaPoly.com. Check out CanadaReport.co, and have a wonderful, wonderful day. Somebody said to me, like, here's like an awful, terrible half hour of news, like your country is burning down. Have a wonderful day. Like, isn't that weird to sign off? But I mean, you have to find the silver lining, right? Like, realistically, you're in charge of how you view your day. And yeah, there are forces at work that are potentially awful for our country and awful for taxpayers and all of that other stuff. But you should live your life, right? Like, you should go out and have a wonderful day. You should go swing on swings, push kids, talk to your family, talk to your friends, and not about politics, not to convince them about something, just to talk to them, to hang out with them, to enjoy their company. Have a wonderful day. That's what I mean. That's what I'm talking about. So please go have a wonderful, wonderful day.